The topic we are going to discuss in this lecture is congenital obstruction and management in lacrimal duct drainage system. We are going to start with nasolacrimal duct obstruction. The lower end of the nasolacrimal duct in the region of the valve of Hesner is the last portion of lacrimal drainage system to canalize, complete patency most commonly occurring soon after birth. Epiphora affects at least 20% of the neonates, but spontaneous resolution occurs in approximately 85% within the first year. Patients present with signs of epiphora and matting of eyelashes, may be constant or intermittent, and may be particularly noticeable when the child has an upper respiratory tract infection. The matting of lashes can be seen in this picture here. The lashes are matted, there is crusting here, and there is some redness here as well. Superimposed bacterial conjunctivitis may be treated with a broad-spectrum topical antibiotic. Gentle pressure over the lacrimal sac may cause mucopurulent reflux. Acute dacryocoele is very rare. Normal visual functions should be confirmed as far as possible, and an anterior segment examination with assessment of the red reflex performed. The fluorescence disappearance test is highly specific in this setting. Only a fine line of dye at most should remain at 5 to 10 minutes under inspection with a blue light in the darkened room. We have discussed the fluorescence disappearance test in a previous lecture. I will link it in this lecture as well. Now, after this, the differential diagnosis includes other congenital causes of water and dye, such as punctal atresia, congenital glaucoma, which is a very important cause and should be ruled out, chronic conjunctivitis, for example in cases of chlamydial conjunctivitis or keratitis, and uveitis. Now, treatment starts with a massage of lacrimal sac, the most common method, and has been suggested as a means of rupturing a membrane obstruction by hydrostatic pressure. The index finger is initially placed over the common canalicles to block reflux and then rolled over the sac, massaging downwards. The likelihood of success and the optimal regimen is undetermined. If it fails, the next option is probing. Passage of a fine wire via the canalicular system and nasolacrimal duct to disrupt the obstructive membrane at the valve of Hesner is usually regarded as the definitive treatment and may be preceded and followed by irrigation to confirm the site of obstruction and subsequent patency respectively. Probing can be repeated if a first procedure is unsuccessful. Nasal endoscopic guidance may enhance success and should be considered at least for repeat procedures. If symptoms are mild to moderate, probing may be delayed until the age of 12 to 18 or even 24 months and is carried out under general anesthesia. For more marked symptoms, early probing may be appropriate, and in young children is sometimes performed under topical anesthesia in an outpatient setting. Risks include the induction of canalicular stenosis due to probe trauma, which may be relatively common. It should be noted that there is little evidence of a difference in final outcome at 24 months conferred by intervention versus non-intervention. Failure of probing may result from abnormal anatomy, which can usually be recognized by difficulty in passing the probe and subsequent non-patency of the drainage system on irrigation. Options after probing failure include intubation with silastic tubing, with or without balloon dilatation of the nasolacrimal duct, endoscopic procedures, and dacryocoele. The next pathology we are going to discuss is congenital dacryocoele. Now, a congenital dacryocoele or amniotocoele is a collection of amniotic fluid or mucus in the lacrimal sac caused by an imperforate Hasner valve. Presentation is perinatal with a bluish cystic swelling. At or below the medial canthus, accompanied by epiphora. If an intranasal component is large, it can cause respiratory distress. It should not be mistaken for an cephalocele, the latter being characterized by a pulsatile swelling above the medial canthal tendon. Resolution is common with only conservative treatment, but if this fails, probing is usually adequate. So now we are going to wrap this up and move on to the next topic. If you like the lecture, please press on the like button and subscribe to the channel. Thank you all.